Cervical cancer is when the cells of the cervix, the lower part of the woman's uterus, start growing out of control. If detected at an early stage, it could be successfully treated. The conscious effort to prevent it and follow measures to keep a timely check on it could help protect from this disease. The human papillomavirus or HPV is the cause of cervical cancer. It is usually spread by coming into sexual contact with a person who is infected with HPV. HPV is of many types, and not all HPV develops cervical cancer. This infection is most commonly found in females at the start of their sexual activity, may disappear on its own, but may also develop into genital warts or more severely cervical cancer. The routine diagnosis, following some abnormal symptoms like bleeding from the vagina or pain in the lower abdomen, involves the Pap test. It is scraping off a portion of the cervix and observing the cells for some undesired growth patterns. Getting a Pap test regularly after 2 years of sexual activity will help keep the problem in check. Using a condom also helps prevent this disease to some extent, though not 100%. Apart from the routine checks and the precautions, the infection can be prevented by taking the HPV vaccine. It prevents against the type of HPV that causes cervical cancer. The US FDA have approved 3 vaccines for HPV. All of them can prevent most cases of cervical cancer if given before a girl or woman is exposed to the virus. They can also prevent vaginal and vulvar cancer in women. But if these vaccines are also given to boys, it might help spreading the virus and protect girls. Cervarix, for girls only. Gardasil, can prevent genital warts and anal cancer in both men and women. Gardasil 9, can prevent genital warts and anal cancer in both men and women. The FDA has approved a 2-dose schedule for boys and girls initiating vaccination with Gardasil 9 at ages 9 to 14 years, with the second dose to be administered 6 to 12 months after the first. If initiating the HPV vaccination series at older ages, including teens who begin getting vaccinated after they turn 15 years old or who are immunocompromised, should still be vaccinated according to the earlier approved 3-dose schedule, in which the vaccines were divided over a period of 6 months. There are at present no serious side effects of the vaccine, apart from the commonly observed side effects from other vaccines. The key component of any disease prevention is to monitor its activity when it would be most easily found and act well in time to be safe and healthy.